Ortho Carolina Center for Sports Medicine in Charlotte, North Carolina is pleased to present an educational video on the anatomy of the knee. This video is presented by Stephen Brown, Pat Connor, Don D'Alessandro, and Jim Fleischle. The knee joint is one of the largest and most complex joints in the human body. It is also one of the most frequently injured joints for two reasons primarily. First, there is little inherent bony constraint at the knee joint, and it subsequently relies on capsular, ligamentous, and musculotendinous structures for stability. Furthermore, the knee joint is subject to large moments created by forces acting on the long lever arms of the lower extremity. The knee joint is comprised of three independent bony articulations, one between the patella and femur, and two between medial and lateral tibial plateaus with their respective femoral condyles. To the untrained observer, the knee may appear to function as a simple hinge joint. However, quite the opposite is true. Knee motion is a complicated orchestration of coupled movements involving rolling, sliding, and rotation. In all, there are 6 degrees of freedom involved in knee motion, 3 translational and 3 rotational. Shown here with the extensor mechanism reflected, we see the 3 translational movements, axial, medial lateral, as well as anterior posterior, and the 3 rotatory movements, internal and external rotation of the tibia on the femur, varus and valgus rotation or adduction, abduction, and flexion and extension of the knee joint. Before proceeding to the cadaveric dissection, let us briefly review some of the bony anatomy of the knee joint. From this anteromedial view of a right knee, we can see the tibial tubercle, the attachment site of the patellar tendon. Just medial to this is the area of the pes anserine, where the medial hamstrings attach. More medially, we can appreciate the medial epicondyle and adductor tubercle, the attachment site of the adductor longus and the origin of the MCL, as well as the medial patellofemoral ligament. Laterally, we see Gerdy's tubercle, the attachment site of the iliotibial band. We can also notice the proximal fibula as it articulates with the tibia. This is the insertion site of the lateral collateral ligament, the biceps femoris, and other posterolateral corner structures. On the lateral aspect of the femur, we see the lateral epicondyle, which is the origin of the lateral collateral ligament, and the popliteus tendon. We will take a detailed look at all these structures later during our cadaveric dissection. As we begin to take a closer look, let us first proceed to the medial side of the knee.